Hi, my name is Nicola Lam, and I'm going to talk about disorders of fluids and electrolytes, electrolyte and acid-base disturbances in patients with diabetes mellitus. Definition: the prevalence of diabetes is increasing rapidly, and type 2 diabetes now accounts for 20 to 50% of cases of new-onset diabetes in young people. Electrolyte disturbances are common in patients with diabetes and may be the result of an altered distribution of electrolytes related to hyperglycemia-induced osmotic fluid shifts or of total body deficits brought about by osmotic diuresis. Complications from end organ injury and the therapies used in the management of diabetes may also contribute to electrolyte disturbances.
So large segments of the population have undiagnosed diabetes. One third to one quarter of diabetes is undiagnosed. Young people in particular have undiagnosed diabetes, 40% in the age group of 20 to 44. Also, certain race ethnic groups, non-Hispanic Asians, Hispanics, Mexican Americans, and blacks as compared to whites. Part of the reason that Asian Americans are going undiagnosed, we think, is because of their tendency to have lower BMI levels and to go undetected as a result. This is despite the fact that they have a higher cardiometabolic risk associated with lower BMI levels. So that's why the American Diabetes Association recommends that non-Hispanic Asians be tested at a BMI of 23 or greater. There are large segments of the population who do not have optimal control of their diabetes. 50% only have their A1C levels less than 7%. 70% have their blood pressure less than 140/90. 55% have LDL less than 100, and less than 20% have all of these factors controlled simultaneously. The most prominent risk factors for having undiagnosed diabetes relate to access to care. It was found that those who had not seen a doctor in the past year had a six-fold increase in undiagnosed diabetes. And this is after other factors are considered, such as age and race and income and education, which all affect the odds of undiagnosed diabetes, but these were the most important.
Applications in medicine. Without enough insulin, your body begins to break down fat as an alternative fuel. This process produces buildup of toxic acids in the bloodstream called ketones, eventually leading to diabetic ketoacidosis if untreated. Sodium. Elevations in glucose concentrations increase plasma tonicity, creating an osmotic driving force that favors the movement of water from the intracellular space to the extracellular space, thereby diluting the extracellular space to a concentration of sodium. Potassium. Insulin deficiency, which is more common in type 1 diabetes than in type 2, is an important factor in the net efflux of potassium from the cell. Acid-base disturbances. Ketoacidosis results when the rate at which a hepatic ketoacid is generated exceeds peripheral utilization and the concentration of ketoacids in the blood increases.
About 90% of people with diabetes have type 2 diabetes. If you've got type 2, the insulin your pancreas makes can't work properly, or your pancreas can't make enough insulin. And we all need insulin to live. It does an essential job. It allows the glucose in our blood to enter our cells and fuel our bodies. When you have type 2 diabetes, your body still breaks down carbohydrate from your food and drink and turns it into glucose. The pancreas responds to this by releasing insulin. But because this insulin can't work properly, blood glucose levels keep rising, so more insulin is released. For some people with type 2 diabetes, this can eventually tire the pancreas out, meaning their body makes less and less insulin. This causes even higher blood glucose levels. So what does this mean? Well, as your body can't get enough glucose into your cells, a common symptom of type 2 diabetes is feeling very tired. Other symptoms include needing to wee a lot, feeling extremely thirsty, cuts and grazes healing slowly, and getting infections like thrush. A lot of people don't get any symptoms or they don't notice them. Some people don't think the symptoms are important, so don't ask for help. This means that people can live with type 2 diabetes for up to 10 years before being diagnosed. And over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. These are known as the complications of diabetes. But with the right treatment and care, the effects of diabetes and high glucose levels can be managed. So if you've got any of these symptoms, see a doctor as soon as possible. There are different ways of treating type 2 diabetes. Some people can manage it by healthier eating, being more active and losing weight. Eventually, most people will need medication to bring their blood glucose down to a safe level. Whatever the treatment, everyone with type 2 diabetes needs to learn how to live with it. We help people do exactly that. Take a look at our website to see how we can help you. Our researchers are also investigating ways to put type 2 diabetes into remission, so people's blood glucose levels return to normal and stay there. And they're finding out more and more about type 2 diabetes, so that we can do more to prevent it, find new ways to treat it, and one day find a cure.
Pros and cons. Pros. The treatment of diabetic ketoacidosis involves the administration of insulin and intravenous fluids to correct volume depletion. The primary goal of therapy of hyperkalemia acidosis tubular renal is to correct the hyperkalemia. In many instances, reducing the plasma potassium concentration will correct the acidosis. Hyperkalemia is frequently presented on admission in patients that have diabetic ketoacidosis, even though total body potassium levels are reduced. These are the cons.
So you have type 1 diabetes. It's something you're going to manage, mostly with insulin, a hormone your body doesn't produce when you have type 1 diabetes. By now, you probably know how and when to give yourself insulin. And if you have an insulin pump, you probably know how to maintain it. But do you know how to tell if something's not working? That's what we'll be looking at. You eat carbohydrates to fuel yourself with energy. Your body breaks down the carbs into sugar, which then goes into your blood. Think about it like filling up the gas tank in a car. When you eat, your body stores the carbs to use as energy when you need it later, like filling up the gas tank. Insulin is what opens the tank to let the gas in. As someone with type 1 diabetes, you don't produce insulin naturally, so the sugar doesn't get to where it's supposed to be, which is why you take insulin. If you're not getting the insulin you need, the sugar you eat stays in your blood instead of being stored in the tank. When this happens, your body won't have the fuel it needs when it needs it, and your body will seek out alternative sources to break down into fuel. One of the first sources it looks for is fat. Except when your body breaks down fat, it leaves ketones in your bloodstream that make your blood acidic. Together with high blood sugar, acidic blood from the ketones can make you sick and put your body in a state of diabetic ketoacidosis, or DKA. And DKA is really serious. It can even be fatal. The most common reasons for DKA happening are developing type 1 diabetes, missing taking your insulin, getting an infection, and malfunctioning equipment. Your body will give you plenty of pre-DKA warning signs before you're in serious danger. You may pee more than usual, which is your body getting rid of the sugar that isn't making its way into your cells. You may feel thirstier than usual, which is your body diluting the unused sugar in your bloodstream with water. You may find yourself breathing faster, which is a way your body tries to compensate for acidic blood. And you may feel tired and weak. If you notice any of these warning signs, check your blood sugar and also check your blood or urine for ketones. If you are worried or you're not sure what to do, call your diabetes care team or go to the hospital. Remember these easy steps to prevent DKA. Test your blood sugar regularly. Always take your insulin even when you're sick. If you are sick, stay hydrated, and you may need to take more insulin than normal. If you wear a pump, check regularly to make sure it is connected and working. And if you notice any of the DKA symptoms, check your blood or urine for ketones. Want to know more about DKA? Have other questions about managing your diabetes? Ask your diabetes care team and stay tuned for more videos to help you stay healthy and continue to live the life you want.
Issue applied in Ecuador. Diabetes mellitus is a non-transmissible chronic disease with a high prevalence. In Ecuador, this illness is one of the main causes of mortality, and it is related to many diseases that are produced as a consequence or a degeneration from diabetes mellitus due to age and also because of a bad management of the disease by the affected person or their relatives. Conclusion. In summary, the dysregulation of glucose homeostasis leads to many direct and indirect effects on electrolyte and acid-base balance. Since the high prevalence of diabetes ensures that clinicians in virtually every medical specialty will interact with these patients, familiarity with related electrolyte abnormalities is also important. Thank you.